Mother's Day is here. On behalf of the Health Inquiry Channel, I wish every mother in the world a happy Mother's Day, and I want to offer every mother the most meaningful gift I can give, a science-based, actionable guide to breast cancer, its realities, its risks, and how we can prevent it or catch it early. This isn't just information, it's a practical roadmap to keep your health firmly anchored on the left side of the health spectrum. At the Health Inquiry, we've always said health is far more than the absence of disease. In our foundational video, A New Way to Think About Health, I introduced the health spectrum, a continuous line where the far left end represents complete physical, mental, emotional, and functional vitality, and the far right end is the cessation of life. None of us lives at the perfect left extreme, and none of us wants to reach the right. Every day, our choices nudge us left or right. Breast cancer is one of the clearest signals that a woman's spectrum has been sliding rightward for years, often silently. The empowering news? We can reverse that slide. Knowledge plus daily action moves us left toward optimal wellness, protecting not only mothers, but the entire family that depends on them. The data, awareness without alarm. According to the American Cancer Society's most recent Breast Cancer Facts and Figures report, approximately 1 in 8 women in the United States, about 13%, will be diagnosed with invasive breast cancer in her lifetime. For 2026, the projections are 321,910 new cases of invasive breast cancer and 60,730 cases of ductal carcinoma in situ, DCIS. An estimated 42,140 women will lose their lives to the disease this year. Age distribution tells an important story. Under 40, roughly 4% of cases, 40 to 49, about 10 to 12%, 50 to 59, around 22%, 60 to 69, the peak at nearly 29%, 70 to 79, about 22%, 80 and older, around 11%. The median age at diagnosis hovers near 62 to 63, yet a troubling trend persists. Incidence among women under 50 has been rising faster, about 1.4% per year, than among older women. Globally, breast cancer remains the most diagnosed cancer in women, with roughly 2.3 million new cases reported in the latest worldwide data. While death rates in the United States have fallen 44% since 1989, saving more than 500,000 lives through better screening and treatment, progress must continue everywhere. These numbers are not meant to frighten. They are a call to action. No matter your age, it is never too late, or too early, to begin nudging your personal health spectrum leftward. Understanding risk factors, what pushes the spectrum right, and what we can change. Breast cancer arises from a combination of factors, some fixed and some within our control. Non-modifiable risks include increasing age, being female, family history or inherited mutations, such as BRCA1 or BRCA2, which can raise lifetime risk to 50–85%. Dense breast tissue, early menstruation, before age 12, or late menopause, after 55. Never having children or first pregnancy after age 30, and not breastfeeding. These elements set the stage, yet they do not write the final script. The modifiable risks are where real power lies, the daily levers that determine whether the genetic gun is ever fired. Key modifiable risks include overweight or obesity, especially after menopause. Fat tissue produces estrogen. Physical inactivity, alcohol consumption, even one drink daily raises risk. Long-term hormone replacement therapy, when not medically necessary. Diets high in processed foods, added sugars, red meat, and ultra-processed items. Decades of research confirm that women who adopt consistently healthy lifestyles can reduce their breast cancer risk by 30 to 50%. This is the living proof of the health spectrum in action. Small, repeated choices in the 5 pillars: South, sleep; North, nutrition; East, exercise; West, willpower; and Center, conviction, create compound momentum toward lifelong vitality. Telling the difference: benign lumps versus warning signs. Many women discover a lump and immediately worry. The reassuring truth is that more than 90% of breast lumps are benign. Think cysts or fibroadenomas. Still, self-examination cannot give a definitive answer. Professional evaluation is essential. Typical benign features, often harmless, include soft, smooth, and movable, like a small grape. Tenderness that fluctuates with the menstrual cycle. May shrink or disappear after your period. Red flag features that require prompt medical attention include hard, irregular, or fixed in place, like a stone embedded in tissue. Painless, most early cancers are. Skin changes, dimpling orange peel texture, nipple retraction or discharge, enlarged underarm lymph nodes, or sudden changes in breast size or shape. Your monthly self-exam routine. Simple and effective. Perform this 7 to 10 days after your period ends, or the same date each month if postmenopausal. 1. Stand in front of a mirror, arms at sides, then raised overhead, then hands on hips. Check for symmetry, skin changes, or nipple alterations. 2. In the shower, use the flat pads of 3 fingers in overlapping circles, moving from the outer edge inward, covering every quadrant and the armpit. 3. Lie down with a pillow under one shoulder. Repeat the circular exam on the same side, then switch. Any persistent change warrants an immediate visit to your doctor. Professional tools include mammography, recommended starting at age 40 for average risk, ultrasound for dense breasts, MRI for high-risk women, and biopsy when needed. Caught early, the 5-year survival rate exceeds 99%, an extraordinary leftward shift on the health spectrum. 5 everyday actions that move your spectrum left. Prevention is not abstract. It is lived. The American Cancer Society and NCCN guidelines translate directly into the 5 pillars we teach at the Health Inquiry. 1. Maintain a healthy weight. Aim for a BMI of 18.5 to 24.9. Even modest loss, 5 kilograms after menopause, can lower risk by about 10%. Walk 7,000 to 8,000 steps daily and limit late-night snacking. 2. Move your body regularly. At least 150 minutes of moderate aerobic activity, plus 2 strength sessions weekly. Exercise lowers circulating estrogen, reduces inflammation, and boosts immunity and mood. Classic spectrum left medicine. 3. Limit or eliminate alcohol and tobacco. The safest choice is none. If you drink, keep it to fewer than 1 standard drink per day. Quitting smoking protects against multiple cancers and supports emotional resilience. 4. Eat for cellular health. Fill your plate with colorful vegetables, fruits, whole grains, legumes, nuts, and seeds. Reduce processed meats, sugary drinks, and refined carbohydrates. The Mediterranean-style pattern has been shown in large studies to lower breast cancer risk while supporting overall vitality. 5. Consider reproductive history thoughtfully, when life allows. Pregnancy before age 30 and breastfeeding for 6 to 12 months or longer each offer protective effects. These are personal choices, but when feasible, they add another gentle push left on the spectrum. For those at higher risk, knowledge is power, not fear. If you have a first-degree relative diagnosed before age 50, multiple family members with breast or ovarian cancer, or a known genetic mutation, consult a genetic counselor early. High-risk protocols, per current NCCN guidance, often include annual breast MRI starting at age 25 to 30, mammography plus MRI from age 30, clinical breast exams every 6 to 12 months, discussion of risk-reducing medications, such as tamoxifen, or in select cases, preventive surgery. Early, personalized intervention can slash risk by 50 to 90%. Genetic destiny is not final. Informed action rewrites the story. Scientific progress that inspires hope. Over the past 3 decades, we have witnessed a revolution. Targeted therapies for HER2-positive cancers, more effective endocrine treatments, immunotherapy advances, AI-enhanced imaging, and emerging liquid biopsies that detect tiny traces of disease years earlier. These breakthroughs, born in laboratories and refined at the bedside, have already returned countless mothers to their families. The future is even brighter. Precision prevention tailored to each woman's unique biology. Our Mother's Day commitment. Let's move left together. Mothers, thank you for everything you give. Daughters and sons, this is our moment to give back. Help schedule that screening for your mothers. Walk together with them after dinner. prepare nourishing meals with them side by side, and assist them practice the daily habits that keep the health spectrum trending left. If this guide has moved you, please subscribe to the Health Inquiry, hit the notification bell, and join our community of lifelong learners. In the comments, share one single action you will take this week to honor the mothers in your life and nudge her and your own spectrum leftward. I read everyone. To every mother, may your health remain radiant on the left side of the spectrum, glowing with vitality for many Mother's Days to come. Your well-being truly is the greatest gift we can give and receive.